Good afternoon. It is my great pleasure to welcome our next speaker, Dr. Jonathan Metz, who is, and I have everything prepared here, and I wanted to say Associate Professor of Psychiatry and Women's Studies, and the Director of the Culture, Health and Medicine Program at the University of Michigan. However, I just found out that yesterday you accepted the position, and yesterday he accepted the position. Maybe you could say what position
at Vanderbilt University.
But to be honest, it's a director
of the new Center in Medicine and Society.
Yeah. Director of the new Center of Medicine and Society. So it's a big deal. So it's great to have you here, and that's why when Jonathan missed a few, a couple of hours or maybe an hour because,
Absolutely.
well, yeah. So, but you have a good excuse. Dr. Metz has been working as attending physician in the adult psychiatric clinics. He's also teaching courses at the undergraduate and graduate level on race, gender, health, and social justice. He received Guggenheim Award in 2008 and has written extensively and has published several books, quite interesting and provocative, that I would recommend. One of them, Prozac on the Couch, Difference and Identity in Medicine. That was published a few years ago, right? The new and newer ones is The Protest Psychosis, How Schizophrenia Became a Black Disease, and the final that has been just published, Against Health, How Health Became the New Morality. So just the titles to give you some indication of that it might be a treat. And today he will present on gender stereotypes used in diagnosis of psychiatric disorders in women. Please welcome Dr. Jonathan Metz.
Great, well, thank you so much. It's really a great honor and privilege for me to be here for a number of reasons. I love coming to Montreal anytime, and also it's really great to speak at a conference that's so very interdisciplinary and taking so many different points of view, looking at similar issues from very different viewpoints. And it seems like over the course of today, we've heard social science perspectives, we've heard biological perspectives, we've just heard a wonderful, what I would call it, very integrative perspective that tries to tie those things together. And I think if I was thinking like what's my role in this panel, it's to maybe shore up the sociocultural perspective, and that I'm somebody who's trained both as a psychiatrist but also as a cultural historian. So I have an MD and I trained in psychiatry, but also a PhD in cultural and gender studies. And my work really looks almost exclusively at historical, social, cultural definitions and the ways that those social and cultural definitions of gender and of health and of race impact our understandings of disease and what disease is. And so I know that sociocultural aspects have come up in almost every one of the talks today, and I think I'm hopefully going to expand on that point today. And the talk I'm going to give looks at some research that I've been doing actually over the course of the past 5 or 6 years after the book Prozac on the Couch came out, that looks at the expansion of gender stereotypes, particularly in relation to the advent of SSRI antidepressants and the ways that SSRI antidepressants were both innovative treatments psychiatrically, but were also the latest in a kind of installment about a cultural conversation about gender and health, and particularly women's gender and the relationship between women's gender and their mental health. And the research I'll get to in about 15 or 20 minutes after giving you a few jokes up front, we'll look at a kind of extensive study that I've done looking both at American popular media and the expansion in of gender stereotypes in American popular media, and then a quick tour through some research I've done in medical charts. But first I'll say that, as I said in the beginning there, that this expansion of gender stereotypes in relation to what we might call kind of the advent of pharmaceuticals is something that people who do what I do, study the social and cultural aspects of medicine, have been talking about for a long time. And very often this conversation happens under the rubric of a term that's called medicalization. Now, people here might be familiar with that term. Medicalization traditionally is defined as the kind of bringing to the market of treatments for things that might be otherwise what we might think of as normative aspects of health. And so the BMJ, for example, when it was still the British Medical Journal a couple of years ago, had a special section on medicalization. Actually, we did a section on medicalization in the Lancet a couple of years ago. And the consensus there, at least initially, was that medicalization is something that happens when you categorize something as a disease, including birth, menopause, the loss of beauty, into a treatable medical condition. And from my perspective, it's important that feminist theorists and feminist scholars have complicated this notion, particularly as it relates to the relationship between medicalization and pharmaceuticals. And one person who's done this is the feminist philosopher Jacqueline Zita, who's actually taken a term from Peter Kramer from listening to Prozac. And the term is diagnostic bracket creep. And what this means, basically, is that when new psychiatric drugs, when new wonder drugs, Valium or Prozac or something like that come out, what you see is an expansion not just in the prescription of particular drugs, but an expansion actually in the boundaries of what happens as we understand a disease. And so the diagnostic boundaries quite literally expand out and out and out. And for Zita and other feminist theorists, this expansion has tremendously gender implications, that it's not the same for our understandings of women and men. And certainly, if you look at the SSRI Prozac, this notion of diagnostic bracket creep is certainly something that's happened. So if you looked at SSRI antidepressants, for people who don't know, selective serotonin reuptake inhibitor antidepressants, the first one was Prozac. It came out in 1987. I teach undergraduate courses at the University of Michigan, and it's amazing the kind of things that they don't remember, so I have to tell them, Prozac was an antidepressant that your parents might have heard of or something like that. But anyway, when Prozac first came out in 1987, it was, I think, traditionally defined, these are quotes from the American popular media, and it was traditionally defined as a medication that was bought, sold, ingested, and used for a condition that we might conservatively call depression. So articles at the time would say, it does not produce dry mouth, constipation, weight gain, cloudiness. Patients who may suffer from these side effects stand a great deal. Prozac appears less likely than other antidepressants to interact with other drugs. So what you see here is this assumption that basically this is a medication, something we can hold in our hand, buy, sell, ingest. And I'm using that as a point of reference because if you look for the word Prozac or Zoloft or Paxil or other newer generation drugs, in the present day, you'll see a dramatic expansion in the rhetorical use of those medications. So we have terms like Prozac nation, where Prozac is not a noun, it's an adjective, and it's an adjective that actually modifies not this teeny group of people with depression, but an entire nation. And if you look at the uses, we had compulsive shopping. Somebody was talking about it before, but you'll see it's used for compulsive shopping. It's used for PMS. People might know this as an aside, but it's also the #1 medication used for veterinary purposes to treat psychoneurotic canines or something like that. So there's this tremendous expansion. But if you look particularly at conditions related to gender, one of the arguments I've made in one of the articles that I've written is that you look at conditions like PMDD, postpartum depression, neonatal depression, et cetera, that there's an expansion not just in all categories, but in categories that we might have, for better or worse, prior to the SSRIs, considered normative women's life events like menstruation or childbirth. And so the question I want to ask in my talk today is, who drives this process? Who's driving the process of diagnostic bracket creep? Who's responsible for expanding these categories outward and outward? And really, what are the implications? And if you're anything like me, who's a kind of, slightly suspicious person anyway, particularly of things related to capitalism, I sound like a traditional American, I'm sure, that really the first answer that comes to mind is that this is something that's being driven by pharmaceutical companies. And you see a lot of rhetoric in the medical literature now, but also in critiques of medicine, that words like drug companies create their own markets, the corporate construction of disease, industry's unprecedented influence in changing perception about health and illness. So the assumption basically is that pharmaceutical companies are the drivers of this process of medicalization. Now, let me be very clear that I, on one hand, entirely support that narrative. I've done a lot of research on the pharmaceutical industry. I think medications are important. I'm a practicing psychiatrist. I prescribe medication. I'm not being a pharmaco-Luddite or whatever the term might be. But I would say that, that if you look at this process of medicalization, pharmaceutical companies are in many ways very, very adept at taking information about pharmaceuticals and information about normative gender roles and using it to expand market share. Here's an ad for a Paxil ad from the American Journal of Psychiatry from several years ago. And again, it's like this process of like, here's a woman who looks like Hillary Clinton who's just come back from her grocery shopping. And so this assumption that basically a working woman coming back, either the child got his mommy back from depression or he got her back from work, but Paxil is the treatment in any case. But again, very adept at understanding some of the cultural pressure. So I'm not at all trying to say that I don't believe in that.